Okay, so right now we're in the training environment and I'm going to show you the new workflow on a fake patient. Linda Chair. If you go over to the MAR, you're going to see that Dr. Sperling here has ordered her to have NS with 20K at 50 mLs an hour. And this has been running for a little while. Now, if a physician were to modify the order or to enter a new order, what would happen after the new rate is signed here is that the old order would fall off and the new order would appear. So this is similar to our current workflow. The thing you're going to see that's different is what happens once the order is in the MAR. So what you're seeing now is the discontinued order. This is the new order with the new rate. Okay, so if you click into here, so this is, we're pretending that the patient has the bag still hanging in the room because you had just hung it at 12. So you're not hanging a new bag here, you're just changing the rate. So what we're going to do is click on the do button, and down here under action we're going to put rate change because we're not changing the bag. So you don't have to scan the patient or scan their wristband or the bag or anything like that, just changing the rate. So you're going to hit accept. And if you're like me, what you do is it says rate change, it says 13:45, that's about the time that it is now, 13:43. So normally what I would do is just hit accept. But if you do that, this thing is going to show up. So this is where the new part comes in. So what it's saying to you is that you can't chart this as being given at 13:45 because your due action was at that same time. And so it doesn't understand what to do when there's two. So all you have to do is change this time to another one. So I'm going to make it exactly what time it is now, 13:44, which is just a minute before it was actually due. Then I'm going to hit accept, and it will accept it and go through like this, but what you'll see is the do button doesn't clear. So what you'll have to do is to click the do button, and then under action, go to cancel entry or clear due time, and hit accept. Now, I understand that this is a couple of extra clicks and people are not really going to love having to do that extra little piece, but try to remind people that rate changes don't happen that often. And so this shouldn't be something that they'll have to encounter too much, but your first time you see it, it might raise some questions. So that's what we're going to help them figure out how to do. So just remember, all you have to do is change the time so the rate change doesn't conflict with the due time. All right?